Dr. Trager, what are some of the conditions that someone may have and could expect some kind of alleviation or improvement if they have a Trager session?
I have worked extensively in migraine, in muscular dystrophy, multiple sclerosis, strokes, any type of paralysis, and post-polio sequelae, which is coming on now. Those that have had polio from the epidemic 20, 30 years ago or more.
Yes, I heard about that.
Yeah. Well, now they're coming down with weakness, and finally some are hitting the bad ones, have to go back to crutches and wheelchair, and even the iron lung. It depends how bad they were hit before. And post-polio sequelae responds very good to this work.
Oh, great.
So we do have something. I was in the handing out the vaccine during the polio epidemic. And it'll respond to any condition. It'll be better for having come. We find this. Low back pain, all the low back, shoulder pain, stress, burnout, all of these things.
6,000 is what Emily wants you to get.
What's
Something
that?
about 6,000 low backs.
Oh, all right. I quit counting a long time ago, but I've done over 6,000 backs, low backs. And 90% have had one treatment. A lot of it to do with metastasis. Yes, I do a good job on backs. And one thing that steered me off of buying these supplements, not supplements, like Enquire, like Globe, it was in Globe, where they named me as one of the 4 leading specialists on backs. And they copied something out of the Vancouver Sun. They never interviewed me at all. Well, there it was, so I'm off of all of those newspapers.
That's funny. Well, isn't it, I was flabbergasted to learn that next to the common cold, the back problems are the most prevalent.
And they respond very easily.
And they respond very good to Trager. Oh, that's great. And I'm happy that you brought up this post-polio
sequelae.
Because I recently heard that on the news, and they're very puzzled by that. So you're saying that
Oh, there's nothing to be puzzled. It's not the virus again. It's not the virus that's hit them again. It's just that the muscles, like even anybody that's, as they're getting older, the muscles that were damaged or hurt and when they were younger will be the first to be hurt again or weakened as they get older.
So in summary, Dr. Trager, who then could benefit from Trager?
I think everybody could benefit from Trager. Everybody.
But then also, if you have a certain kind of physical discomfort, if it be it migraine or, it surprises me that something like multiple sclerosis or, what else did you mention?
Multiple sclerosis responds very good. Muscular dystrophy, which is a tougher one to work with, but they respond.
But they respond. Is there a certain number of Trager sessions that one undergoes, or can you go 1 week and then go again next month? How does that work?
In all of my life, I've never told anybody, you've got to have 10 treatments, 3 treatments, or what. I will tell them, try it on for size. If it fits you, you're crazy if you don't come back.
And is each session different? Or?
Every session is different. Every session is different somewhat. You find something different every time you work on somebody.
And I know in the brochure it says that the practitioner begins, the practitioner herself or himself is in a meditative state.
You come into this meditative state in the manner in which you work, and then you're in hookup with this power that does exist outside of yourself.
You know, it's very strange because although I have been consciously, I feel that it's been conscious on my part of understanding more of who I am, I still want to talk about it in the sense that I'd like the audience to know that you seem to be, you know, beautiful aura. I mean, around you is this beautiful, beautiful energy. It's incredible. And my question is, we really are learning more of who we are, aren't we? I mean, not so much who we are, but like say 10 years ago, I wasn't aware of this energy, whereas now when I meet other people, I'm aware this energy, so that we really are learning facets of ourselves that the information wasn't there, or maybe it was there, but it wasn't as common.
To just bring in something at this moment, I bypass the conscious. I'm only interested in the unconscious. I bypass the conscious. I have no use for it. That's something you're trying to manipulate and trying. My first lesson is to stop trying. Just stand there, let it happen. You can only give what you honestly have developed inside of yourself, and not one speck more. Not one speck more. So then what are you working so hard for? You're trying to impress the patient? That's real stupid.
Dr. Trager, so someone could go to a Trager practitioner. What if someone wanted to become a practitioner? I mean, it sounds to me that being a Trager practitioner would enhance one's own development, one's own personal development.
I find in my practitioners, saw one today, Phyllis, and Phyllis, I just couldn't get my eyes off her face. She's radiantly beautiful and open, which she never was before. And others in there, and others after they were on the table, they got off and they looked like they've been redone. And I get such a pleasure out of seeing this happen, being part of the happening. They become different people because they've been tuned into this thing. I think what would help a little bit here is the word vibrations, which you've heard a lot about. Let us say that we are walking down the street downtown or something, and we are looking at people. We always do. We look at people, but we're looking at them and we're saying, gee, that's a nice guy. Then you look at, wow, I don't want to get caught with that. And that back and forth, and you snap judgment. They didn't even look at you. They didn't, nothing. They didn't do anything to you. And yet you're coming to snap judgments. Yeah, but this is the unconscious mind, not the conscious mind. And the only thing that can be happening, is their vibrations hitting you. That's the only thing. So to develop to a point to where your vibrations coming out of you everybody will want to be around you. And there's some patients that would say, you know, at work they wouldn't give me the time of day. Now they're all fighting to give me a glass of water or something. But his vibrations are such they want to be around him. They like him. And the people, like, I remember a long time ago, this family in Los Angeles, they had this daughter. She was about 35 and didn't have one redeeming character. And she said, Milton, she says, don't you have a nice man for my Beatrice? And I says, so I just lied a little bit and said, I'll look around, see? But she didn't have, her vibration was such she couldn't attract anything special. And
it had nothing to do with physical appearance.
Nothing to do with it, just vibrations.
Yes.
And we've got to know that this is happening all the time with everyone we meet. You are evaluating. We can't help ourselves. This is fact. And if only would know this, to come to a condition to where your vibrations will be such that your position in life will be different, that everybody you meet will be better, and the children, if you're lucky to have them then, will be different.
Are you saying, though, that when the mind is evaluating, its evaluations are coming from the vibrations that
you're picking up? From the vibrations that's hitting. What else is there? That's all that's happening.
Well, I never thought about it.
Well, now you can think about it.
That's true. Huh.
That's true. It's damn true. Excuse me.
So what happened to that woman? You were saying that she didn't have any redeeming characters.
Well, that was all. Just asked me to look for a man for him. There's nothing I could do.
Oh, I see.
No.
I thought maybe you started working on her.
Oh, no. That was before I started working in that area.
So in any city, then, I assume that there are Trager practitioners?
We have, I think, between 2,000 and 3,000 have been trained all over the world. In fact, Australia, one of our real great students is going there to deliver a physical therapist at the International Physical Therapy Conference. We'll be delivering something called the Trager Approach. She has a 15-minute thing to be put on then. So that's going to reach a lot of physical therapists. It's just growing like just all kinds of things.
The effects are not so much accumulative, but each time you go...
The effects are accumulative.
They are.
They are.
And each time your body is worked on, then just by these movements,
Let's
your
just say body-mind is worked on.
body-mind.
Yes,
Okay.
ma'am, don't divorce the mind.
So it's not only movements of the body, but
Oh,
it's...
no. It reaches the mind, and the mind is where the thing works that sends a message back to the tissues. The tissues let go. You know, a cute thing here, excuse me. Like I've been trying to analyze what the patient's mind is saying. I know what I'm saying. I said, it should be like this, should be better, should be better. And what's happening in the patient's mind is saying, oh, like that, why don't you say so?
Oh.
This is, I think, what is happening in the patient's mind.
It would be wonderful if we had some visuals that the audience could see the kinds of movements. I had 2 Trager sessions myself, and I want you to know that I am very much interested in having more. But I could tell the audience that I was left with a very moving, how did I feel? It was very gentle and a very moving kind of experience. I do this with my hands because that's the kind of feeling it was, and your body is moved and your legs are moved, and I can see now what you mean, that it does have an effect on your consciousness,
the entire body,
on your entire beingness.
I'm just recently saying that it's on a cellular level, that every cell is being influenced. Just
in passing, I know that I'm aware that the percentage that we're conscious is like minimal to the parts of us that are unconscious anyways, that most of our behavior comes out of our unconscious anyways. I mean, isn't that...
That's right.
Isn't that an accurate statement to make?
That's right.
And so what you're saying is that something like the Trager approach communicates with the unconscious.
Exactly. I like what you said.
Yeah. I also know that your practitioners go through a thorough training before they can be called Trager practitioners.
That's right.
What, just tell the audience.
Well, you start with an introductory workshop, beginner's workshop, and then it goes into an intermediate workshop. And there's a practitioner 1, and there's practitioner 2. Some of them get to me at practitioner 2, but I go 2, 3, 4, and 5. And these are advancements in smaller classes.
And now when could they begin becoming a practitioner?
I would say in about several months they could be a practitioner. Oh, it takes more than that. Yeah.
But at least the audience knows that if they go to a Trager practitioner, it's someone who has had training.
That's
They've
right.
had to complete, I assume, certain qualifications that you have set forth yourself.
Yeah.
Before I ask you what are some of the cases that you've worked on, did you, I'm just curious, how does it feel for you knowing that you have given such a contribution to the planet? I mean, did you know when you were a younger person that this would be what your life would turn into?
Not at all. Not at all. This is, it's way out of our hands. It's way out of, and it's just starting to take off. This I know. And where it's going to go, who knows?
Who knows?
You know, but it can't stop. This I know. If I should go leave this earth next week or something, it'll continue because there's enough practitioners out there that are trained, that are great, that believe in it.
For someone in the audience who wants to know more about Trager, there is a Trager Institute.
Yes.
And that if anyone in the audience writes to me at the end, I could send them the address for the Trager Institute, and then is that how they could then find out who in their city or the nearest Trager practitioner?
We have a catalog of a number in every area. And they'll tell you, they'll forward and give you the names of several practitioners in that area, or tell you there aren't any in that area.
Is there anything else that I haven't asked you that you'd like to talk about the Trager?
Yeah, I have a favorite expression. Instead of talking about this, I could say, lay down, I'll give you a treatment.
Do it.
That's
well, I'm looking forward to having another session with a Trager practitioner.
Yeah.
Dr. Trager, thank you so much.
Thank you so very much.
And thank you for tuning in. Bye-bye.